we are just very happy to have Professor Joyce Sumi with us today. And she's going to give us a presentation. I did send an email to all of you reminding you that there's a wonderful handout, but she may make some changes to that handout, and it will be on our website. We have permission to record in the chat, and it looks like we've got, let's see here. I see a little one. Okay, so go ahead, Professor.
Okay, let me get my screen up here, okay? Give me a second or two. Okay, is that up where everybody could see it?
Yes, it is. And would you please let everyone know that the dental school is open?
The dental school is open. We'll be talking about that. Okay, so but today what we're going to be doing is covering the mouth during the COVID pandemic. So a little play on words, and hopefully this will just be a fun session for you to just learn something. So my name, just like Jeanette Brown said, I'm Joyce Sumi, and I'm an associate professor of clinical dentistry at the Herman Ostrow School of Dentistry. And I am the director of the Community Oral Health Graduate Certificate Program in Community Oral Health. And that's an online program. And I provide community-based interprofessional education with other professional schools at USC. And I've even facilitated in the interprofessional geriatric curriculum program, if you're familiar with that. And that's where we integrate all the different health disciplines. There's about 9 of us that are between Keck and Herman Ostrow School of Dentistry. I personally am a registered dental hygienist. I received my bachelor's degree at USC, but I got my MS at the UCSF up in San Francisco. But I was really thankful that I was already teaching remotely in our community oral health program when the pandemic hit. So continuing teaching that program was not very difficult. It just went smoothly. On the other hand, I also teach right in the school, the hands-on part for periodontal care with dental hygienists. That's how they clean, scale teeth. And that presented a whole new challenge. It was probably one of the most difficult things that I have done, to change the curriculum to teach them remotely how to do something and be able to use cameras and everything on Zoom to be able to teach them how to do a skill. Thankfully now, USC campus is still restricted. Most of the classes are online. However, the dental school is open. Our didactics are online, but we do see patients. We do have most of the clinics open. There's some modifications, both with how they're doing the class and how many people we could have in the building. And so one of the interesting things is, if you ever seen it, to come into campus now, we have to use something called Trojan Check. It's an app. We never had to do that before, but to get in any of the parking lots, buildings, whatever, you have to go through the app. And when we use the app, it screens us for COVID, and it kind of like makes a reservation for you so that they know how many people are there on campus. I don't know if it's exactly the same at Keck, but this is for the main campus down, at USC. And so it's kind of an interesting dynamic when I go to the campus now. It's like ghost town, except for our dental school, which is on the campus. The Keck campus, of course, is on a different area. So if you're more familiar with the health campus, that's one place. But I think some of you visited the main campus, and at that place, you would normally see so many students, so many cars, so many activities happening. It's a ghost town right now, except for the dental school. So if you need dental care, though, you could still probably come. I wear tons of PPE now, and if you don't know what that is, that's protection equipment that I have to wear. It's way more than we used to do. There's a lot more modifications as far as air filtrations and things happening at the school to keep it safe for all of us and for the patients. And my job there is to really improve access and retention for medically compromised people. I work in, if you see this first little thing here, the special patients clinic where we manage mostly kind of cases that people have trouble dealing with in the outside public dental care. But none of my formal education, I felt like I was so equipped for everything in life, prepared me how to order food through Instacart and online during this pandemic. And I revisited recipes from my childhood. I think I probably grew up in an era before so-called healthy food, because I made all this food and gained weight. When I went for one of my medical checks, I found out I gained a significant amount of weight. And so I had to start working on something. I thought what I would do is, like, I usually have a long commute to work, but I thought I'll use that time to exercise and try to do things. It's not been that successful, but one thing to keep me sane and to keep me good is I started a gratitude journal, and I encourage all of you, think of the first thing in the morning, a couple things you're very grateful for, jot it down, and then promise yourself who you're going to connect with that day. I try to do that every day, and it's been kind of just this very rewarding thing that has added so much to my life. So, but now you know who I am. So I was wondering if now I have a little poll, and I think someone's going to help me with that. I just kind of want to know who you are. Does somebody have the poll? Do we have it? I can't hear anybody.
I'm not sure where it's supposed to
No, yeah, I'm thinking more administratively. Okay. Is there somebody that's managing the poll?
I guess I'm going to do it.
Okay.
I thought that Leanne was going to do it, but I guess I do it.
One of you.
So we have to go into chat to see it, right?
Do you see it now?
Yes.
I think it's great, the intergenerational group that we have. So we have employees and retirees as well as students.
So do they see the final result here?
I'm not sure.
Can we end? There we go. Share results. So what I'm really glad though is that I was trying to think if I constructed my information to the right group, and it looks like it's perfect because we do have a mixed group, and I do have a lot of information for people who are right in the highest group there. And so I'm glad. I just wanted to test the waters before I blah blah, and now I know my blah blahs are going to just be accurate. Okay, thank you. Please stop. Take that out. Is the poll gone? It looks like it's
gone.
Oh, it's still on my. Oh, okay. So here, are you prepared? Some of you might be wondering why it's so important to have a clean mouth if you're just covering it up anyway. But the mask actually reminds us how important the mouth is during this pandemic. There's a reason you're covering it up. We're going to discover why a good, clean oral health mouth is especially critical during this COVID time. More and more studies are coming up, and I'll share some with you. It's really critical to understand the mouth can't really be separated from the body. There's relationships with a good or a healthy mouth, a healthy body, and even now we're finding out with the SARS virus. So during these uncertain times, I really want you to start thinking about when you see someone have a mask on, it's so important what's going on underneath. So what do you see when you look in the mouth? It's known that every professional sees a different thing. Some professionals, most medical, they see down the throat. They don't see much of you could quiz some of them, like what did the teeth look like, and they can't remember. Others look at the lips or the skin or the tongue. We found out social workers tend to be looking, the head and neck is one of the highest areas of abuse. And so they look at that area for abuse, neglect, and sometimes addiction problems. So even in our profession, the oral health profession, we test different people, and some people are looking at how clean the teeth are. Do they need a cleaning? Some are looking at how many cavities they have. Some are looking at how straight the teeth are, how many problems or things that they see. But bottom line is everybody is looking at different things. But what we all should be looking at yourself is that the mouth is the pathway to your body. You have to remember the teeth, they're the hardest substance in your whole body. And it's one of the only parts that doesn't heal on their own when it's injured. So if this hardest substance starts to show damage, you have to think what that really means. You know, behavior and food choices start to deteriorate our teeth. Parts of our body may have the initial ability to recover from these assaults, but after years of assault, sometimes they don't recover. And then what we have are health problems. And so now we already know that there's been associations with cardiac disease, blood pressure, diabetes, obesity, hypertension. The mouth has to be really looked at carefully because if you think of it, they're truly the sentinels of our body, the sentinels of good body health. So if we understand that the mouth and body can't be separated, you could almost see how maybe there's some kind of link with coronavirus, the pandemic, and the relationship of health. There's strong evidence that diabetes, high blood pressure, heart disease, joint pain, respiratory diseases, and obesity have been associated with poor health. You can find it in several different papers. Inflammation caused by gum problems increases the risk for all of these diseases. Well, did you know that if you look at all the reports we're seeing about COVID and people who are having severe COVID problems, they'll mention many of these exact same conditions. It's tied together. We know that gum disease, or what we call periodontal disease, increases having these different diseases. We have people who have studied, and it seems like people who have gum problems are 25% increase at risk for heart disease, 20% increased risk for blood pressure problems, and 3 times the risk for a diabetic problem. Nursing homes and hospitals already show older adults with poor oral hygiene have an increased risk for bacterial pneumonia. COVID-19 affects the lungs, so they know that there's some association with now the COVID, lungs, and now we know on the outside there with gum problems. Studies are suggesting that they know that they find even COVID bacteria, nose, throat, mouth, down into the lung, all associated. What happens in hospitals, and right now they're talking about the people who are more severe have to be intubated. They show that the film, biofilm, or we call plaque, or if you ever see the, when you floss or brush, the stuff that collects on your teeth, when they put the tube down into someone's mouth to lung, sometimes it actually puts some of the bacteria from the mouth down there, but also what happens is as that tube stays there, the bacteria forms a biofilm down that tube, direct pathway into the lung. Sometimes there's so much bacteria in the mouth, and I'm not talking about COVID, I'm just talking about just the germs from maybe not cleaning it up, that they have a massive amount of bacteria surrounding all the area, and the term that they use in many of these cases is called a superinfection. That same term is coming out when they talk about COVID virus and people who are getting severe cases. Connection again, maybe. So talking about people and just aging, because we know that it's been in the beginning reports, the older population that's being hit so hard with this COVID. But there are physical changes in us older adults that happen all over, you could see, but in our mouth. And so maintaining good oral health as we get older, as we age, becomes a little bit more difficult. We do know that a lot of people have physical or manual dexterity is what I'm trying to think of, a decline. And sometimes it's just a little bit more difficult to brush and floss. A lot of times it's not our hands, but when I talk to my patients, they're having trouble standing in the bathroom long enough to do a long brushing. So I say, are you brushing long enough? And they're having trouble in the bathroom. Well, you don't have to always do it in the bathroom is what I'm going to tell you. But so physical changes, though, what I'm telling you that happen in the mouth, more recession, more dryness, weaker teeth. There's a lot of changes that happen. So we just have to be more aware that as we get older, we could have more oral health problems. What happens as we get older? We have a drier mouth a lot of times due to our salivary glands. We have maybe more recession, which means part of our teeth are exposed. Do you know those people have more decay than other people? Gum disease, prevalent. 2/3 of older adults have gum disease. 2/3. That means the majority. 1/5, 20%, have lost all their teeth already. But more older adults with losing the teeth are now getting implants. It is an answer for some, but what happens is that's another thing that could get infection. It's got to be kept clean. It's got to be maintained. And people, it's already known that age is a risk factor for getting oral cancer and lesions. Smokers, now HPV even. And so with just age, infection, sores from wearing either dentures or just having a drier mouth become another problem that we have to face. So what do? Looks like we just have to make sure we're taking care of our mouth. And looks like we have to really think about it. As soon as we take the mask off and we're at home, don't forget the mouth is so important. But what if we do have a problem? Didn't all the dental offices close initially? What are we supposed to do? So we have a poll about dental offices.
Joyce, as the co-host, are you seeing the results? Because I'm not.
It's just active right now. Do I have the, could I do this? I could end the poll. Let's see, how many people? 19 out of 25, 20 out of 25. Any other takers? I'm going to end the poll now. Okay, everybody?
And Leanne, can you post it so we can see also? There we go.
So this is a good discussion. It says, during the pandemic, I'll go for, and some feel safe with emergency service only. Most people say essential services with limited procedures. Some think all procedures are okay. And of course, there's a few that still have concerns of maybe there could be a problem with getting the coronavirus. And this is very reflective exactly of all the polls that are being taken right now. So you know what? We've got the most average population here that think like the whole world thinks. Unfortunately for me, when I'm at the dental school, I see a skewed population. And there's many people who they are coming in, of course, for emergency. But we are open for almost all procedures. And the one that I wish would be increased is all service, including elective procedures. Because do you know what elective procedures are? Checkup and teeth cleaning. And so like to have only 1/3 of the people maybe feel comfortable with that, it tells me that 2/3 maybe too hesitant to come. But maybe if we polled afterwards, it would be a different story. Let's see. Okay. So oral health became emergency treatment only right when the pandemic started. It was unfortunate for us that it wasn't viewed as an essential part of health during the pandemic. Only elective procedures in the beginning were completely halted. And it just, when they did that, the important lesson to remember is that some of these evolved into emergencies because people weren't getting care. Before the pandemic, multiple public and professional information studies showed that people who kept regular care hardly ever missed work from an emergency dental care. And people who didn't go regular or even neglected usually had an unplanned or emergency type of dental appointment. So think about that right now. When we're had the offices closed, we were hoping all those people who were essential workers at our health facilities, but there's a portion of them that actually delayed their health, of course, because they were busy, but also they were getting emergencies and they weren't on the job because they had delayed and closed all of the facilities. And so teeth that could have been filled now needed root canals. And teeth that could have had root canals now had to be extracted. And even like some medical procedures need a mouth clearance before they do it, had to be delayed because there was nowhere to do that. And some people who had lesions in their mouth that could potentially have been something serious like cancer weren't even being addressed. And they're still not being addressed right now because people were a little bit too afraid to come. So taking care of your mouth and looking at your mouth, remember that beginning, is more important than ever at this time. Multiple messages about clean hands have been going out and out and out, but I'm really sad that they didn't talk about the clean mouth, because the reason you want clean hands is that there might be the germ on it, but the germ's coming from the mouth. So you have to think about that. If you have anybody in your household or you know anybody who's having trouble with grooming, dressing, medication management, even if it's yourself, studies show that their oral hygiene is usually not as good. So this is an opportunity for you to either, if it's yourself, to reach out and get help, or if you know of somebody and you could help them. It's a challenging time, obviously, for the people in nursing homes, but there are the people who are not in nursing homes, and we still have people struggling at home, and we're seeing them also in the dental school. The evidence shows that this virus is transmitted directly through droplets and aerosols from the mouth. And then the contaminated surfaces may indirectly transmit that virus. And some of the studies say that it lasts on surfaces for sometimes it's hours and sometimes they're saying days. There's a lot of studies still not sure of it, but the bottom line is we do know it is there. How long is the problem? The coronavirus in the saliva can even go out when we're speaking. That's why we're wearing a mask. We've heard about the stories about singing, and it spreads when people sing. So the thing is it's just discharging. They know that a clean mouth helps efforts to reduce the coronavirus, the amount of virus or the amount of bacteria in the mouth. And so we know that logically that it may help prevent the spread of the disease also. So don't forget the real basics. If you clean 2 times a day for 2 minutes, that's been kind of this overall mantra. The two minutes is the one that I see most people are kind of not so strong on, 2 times quickly, but that isn't as effective, okay? And then flossing is also something, because we would like to have something clean between the teeth. We were having an earlier discussion. There's a lot of tools you could use. Sometimes flossing is so challenging, but you want to use any tool that you could help clean between the teeth. It's recommended to use some type of antiseptic mouthwash. And before coronavirus, everybody used Listerine and different type of mouthwashes by Oral-B and such. But they found that the most effective ones are iodine-based and such, but the most common ones that you find in the market are the 1.5% hydrogen peroxide rinses. One of them that was listed, you could see on the handout, is Colgate Peroxo or Oragel peroxide rinse. And both of these, when you rinse with that and you try to gargle, and you do that for at least 30 seconds to a minute, that it helps reduce, technically what it does is it breaks down the lipid envelope of the coronavirus, but it reduces the coronavirus in the mouth. We do that in our dental offices, have them rinse with these before we work on them, in the event there might be coronavirus, to reduce any of the aerosols that might come out of their mouth when we're working with them. A conversation that I had with Jeanette Brown just earlier is that, you know, there are warnings on there. You're not supposed to use peroxide daily. And some people actually use the peroxide bottle that you buy. That's about 3%. And so like, if you don't want to buy the over-the-counter mouthwashes that have peroxide, you can dilute that by 50% with water and use that. It doesn't taste as good. But yeah, you're not supposed to use peroxide rinses daily. And if you buy these bottles, you'll notice the little warning on there not to use it continuously. How I use it though, is that I'm actually maybe possibly with my type of work being exposed, or let's just say I go to the market and I'm afraid if I'm exposed. So I go home and I rinse and I gargle with that. Sometimes I take my toothbrush and I swish it in a little bit of that, because that'll help like clean it. But so what I'm just saying is that the peroxide rinse can be used fairly regular, but there are limitations, that it's not the same as using a mouthwash continuously. This is to help you with when you have COVID concerns, to use it. The more you lower the coronavirus in your own mouth and nasopharyngeal areas, the better. And it actually replicates in the saliva glands multiple times. So the virus. So I'm just saying is, when you're able to use that when you're, you think maybe you might be exposed to COVID, you may be thinking that you are coming down with something that has all those telltale symptoms of COVID, it might be something you might want to have on hand to rinse with. But what if you do for sure? Let's say you went, oh my God, I got tested and, you know, I have COVID, and you're living with someone or whatever. To ensure that, you know, you're keeping as clean as possible in the bathroom, please, you know, your toothbrush and all the implements that you use, clean it in peroxide. I told you you could use even the mouthwash one, but you could just use plain peroxide as far as cost. I even dilute that though, because I'm using it and swishing my brush and stuff in there. So if you have COVID or know somebody who's COVID and you don't want to spread all the probably COVID germs in the bathroom, clean and disinfect your toothbrush regularly every time you use it, and then rinse it well before you reuse it, and then replace your toothbrush often. But what I mean is, after you've finished your episode with COVID, then replace it with a brand new brush and trash that other one, okay? And even if you don't have COVID or whatever, you want to make sure that you're not overusing your toothbrush. This is just general rule. A lot of people use just a 3-month interval and they automatically change it. Most people don't share toothbrushes. That's what this picture shows. But what I wanted to say is, some people, like, they store them all together in a cup or something, and they're all touching each other. This is not the time to have that kind of storage. You know, maybe when we don't have COVID, it's still not really ideal. But right now, because COVID, you never know with the asymptomatic type of thing, it's really a safer practice to not share, keep things away, and just keep them really fresh and clean and in dry air. I have another poll coming up. Okay, I'm going to end it, okay? Actually, this is probably, look at it's a perfect curve here, but for our audience, I expected it to be a little bit more frequent than it is, because we have if we add the bottom half, we have 9 people who seldom or never have it. That's wonderful, okay? Dry mouth is a particular problem that is very prevalent. Medications cause dry mouth. Stress causes dry mouth. Age causes dry mouth. there's a lot of things that cause dry mouth. And what you might not know is it's becoming more frequent. And of course, in the older population, very frequent. And it's starting to cause havoc in the mouth. And we're seeing all of it right now. Oh, how do I get rid of it? Okay. So medical conditions could cause a dry mouth. Medications could cause a dry mouth. If you're a smoker out there, you could have a dry mouth. And a dehydration. And so what happens is when I say dehydration, there's a lot of ways we get dehydration. As we get older, we don't even realize sometimes that we're lacking water. It's some mechanism in our body. But what I want to say is wearing our masks. If you're the type that has put on a mask and go out very much, it's almost for sure your mouth, if you've worn it for any extended period of time, that your mouth is drier. For me, my work, I get more dehydrated because I have the mask on constantly. I have dry mouth. So if I was doing the poll, maybe I would have skewed it a little bit differently. If you have dry mouth, there's multiple products on the market. Even if you said sometimes have it, whatever, you should be thinking you want to hydrate. It's just like if your skin was dry, you want to have lotion on it. You just don't suffer through the dry skin. You do something about it. The dry mouth, you want to make sure that you're addressing it. There's so many products on the market. You want to go ahead and, try one or two. There's so many. And what does that tell you if there's so many? It's a problem that everybody's really having and growing more because of our vast amount of medications that we have. So there's toothpaste, there's mouthwashes, there's mints, there's kind of like a lotion. There's a gel that you put in the mouth and it helps moisturize. There's things that they slip on into the corner of your mouth that slowly dissolves to keep your mouth dry. There's so many, it's kind of like I can't cover all of them right now, but it's something that you might want to just kind of take a glance at and look, try some of them out. Sometimes they're kind of off-putting when it's too slimy, but people who have a very dry mouth, they actually like to take it before they go to bed so when they wake up, their mouth isn't so dry. An excessive dry mouth causes very bad breath, so start thinking about that too.
So Jeanette says, how about just drinking water?
Okay, water on a lot of older people that I counsel, water helps hydrate you, but if you are actually having underactive salivary glands, it's a very temporary type of thing. And then for many people, going to the bathroom is a particular issue, whether it's a bladder problem, prostate problem, whatever. So it becomes a challenge sometimes for some people that they could, if they constantly drink water, yes, they'll be hydrated. If they constantly drink water, their mouth won't feel so dry, but their bathroom issues start to interfere. And some people, they're taking medications to try to get rid of water, and it's a constant battle. So yes, for sure with the water, but if you're doing that, please look at some of the products on the market that might just help. So you could have water still, but you won't have to be excessive. If your mouth is very dry, those people are constantly drinking water. But please, water is for sure a good thing. I'm not trying to say no to that, but people who have a truly dry mouth, it's a really challenge. It's a real big challenge. So food, okay, what about our diet during this time? The consensus is that people are snacking more. Maybe they're just home more. But another one is that it seems like stress is entering our lives. And between alcohol and I mean, some people's snack is alcohol, but between alcohol, drugs, and just the stress of life bringing changes to our habits, people are eating more. I told you I gained weight. I think it's because I have leftovers in the refrigerator and I'm snacking on that. But the more you snack, the more exposure your teeth get to what we consider an acid exposure, because soon as you eat, your pH changes. And so if you're doing it all day, the pH keeps changing and it starts to actually wear on the enamel of your teeth. So people who are frequent snackers tend to have higher cavity levels. Okay, so. Okay. I'm going to end the poll. So what we see here, it's a pretty good curve again. You guys are so in tune to what the world is like, but the actual results for post-COVID or during COVID now from before is that the top is increased tremendously. We don't know if it's the stress that people have. People are having more sleep problems. I think we're going to be having somebody talk about sleep problems in one of our wellness sessions, but there's more sleep disturbances and more stress. And the way people are coming in, they're actually having more problems with their teeth. And so when we look at this, sometimes it's interesting that if I asked, how do you know you're grinding your teeth? What do you feel that it is? Some people, they don't know they are, and they are. And some people think they are, and they're not doing it as much as other people. Some people, they say, my husband hears me when I'm sleeping, that, you know, they hear this gnashing sound, and other people wake up with headaches and don't know why. So we're going to talk about that. It's a well-known fact that stress and anxiety is up right now. And it's also a well-known fact that stress could bring on what we call bruxism. Bruxism is the official term where people could clench, which is bite down their teeth, and then they grind, which is moving it around. And we call either of those conditions bruxism. But when we see someone who has a severe case, I don't know if you could tell, but these teeth have been worn down quite a bit. We see people like this and they don't even know they're grinding their teeth. They just want to know why their teeth are getting shorter. Well, during this COVID time, we're seeing people coming in with broken fillings, chipped teeth, and they haven't been, maybe they've been clenchers, maybe mild, sometimes grinders, but it's increasing now. And one thing we talk about, how are your sleep going on right now? And they're saying, well, you know, I'm not sleeping as good or this or that. And we're finding out that, yes, they're having this bruxism problem. So it's really interesting to see how the mind stress is creating now teeth problems. So the sleep problems will be addressed, I think, in a future session. So that part, but in the meantime, what you need to do is think about how you could do exercises to relax. There's meditation apps, there's yoga stretches. And if it's real severe, please, you know, try to contact some doctor, health professional to help you with this. So for those who are already having a little bit, maybe you have muscles that are sore from clenching and grinding. I'm going to give you a couple stretch exercises that we do when we see somebody who comes in. They wake up in the morning and they have like a headache, or their muscles here feel tired. So, all right, all of you who want to do this, you want to just be able to open your jaw downward, and it's just a stretch. And you want to close your mouth. You want to do them slow, open and close. And sometimes you want to do it in front of a mirror to see how you just like stretch it and close it. Now when you open, put your tongue in back behind your front teeth. This helps actually relax the jaw muscle. The next one, you put your chin to your chest and just pull it forward, okay? And open your mouth. It's a little bit different muscles. They're all concentrating on the side. Another one is tilt your head to one side and then tilt it back. It's over here that should feel a stretch. The other one is tilt it to the other side and tilt it back. These are different than these muscles, which is also stress muscle. It's concentrating on these, okay? The other is like that picture. Say the letter N out loud, okay, and stretch it, almost kind of like exaggerate it, and push your tongue up and keep your mouth open like N, N, and it should feel like a pull. It's a pull backwards now. And then all the time while you're doing this, a lot of times is just gently massage your jaw to loosen up the muscles. These muscles are concentrating all the ones that are in here. And these are the ones when you're sleeping, they might be clenching and making it tight in the jaw. So relaxation things you could do. There's muscle ones for the neck and such, but these are the ones for your head, okay? Big message that's been going around is wash your hands. What happens is the studies show that we touch our face 23 times an hour. I even see people with masks. How many times are they touching that mask, adjusting and whatever? So that includes it, the 23 times an hour. But this poses a threat. When you touch your own mouth and there's a virus in your saliva, you potentially could transfer it to others. So it's a cycle of clean hands and the cleaner mouth that we were talking about that's important. I just wanted to talk to you because everybody's cleaning their hands, but when I see some of my patients wash their hands or put on the, what do you call that, the alcohol cleaner, they're missing the typical areas that we all know. And so if you could see, especially look at the green areas where someone's been missing. They're all to the tips of the fingers, that thumb, and in between. So guess what we're gonna do? We're gonna wash our hands because I just want you to go through it once so you know the right way to wash your hands, okay? Thinking of that. So let's do this together. You do palm to palm when you put that soap on. And cold transition, make sure you're getting between your fingers. Flip to the back. Remember that green part between those fingers? Get the other side, okay? Then remember that thumb? Get that base of that thumb like this. And the other one. A lot of people only do one and they move on. Get the other one. Back of your fingers. Other side. Fingernails. So many people don't do that. You get the bottom tips of your finger. Remember those green tips? Try to remember to do this when you're doing your, and then the last part is we do this, but a lot of times right here, you want to make sure it's clean. And then now you could rinse. And if you practice that order, you'll get better at it. And in your mind, try to remember those green spots. Too many people, I see them putting the alcohol wipe on and it's done, but you know what? If there was any coronavirus, it might still be there. And so real quick, now that your mouth is clean and your hands are clean, what do? We cover it up. Wearing a face mask sometimes make people aware they have bad breath. Okay. More than 50% of the population actually have halitosis, different types. And when we wear a mask though, the moist air evaporates into there. If we have any of the bad smell in our mouth, it evaporates and now we have this foul smelling mask. Mouth breathing causes dryness in our mouth, I was telling you, and it increases your risk for cavities. It increases your mouth for smell. And so what you want to do is make sure that you're cleaning your mouth, okay? Cleaning your mask and keeping your hands off of it. And so if you have gum disease though, gum disease has a very unique smell. And even if you brush and clean everything and brush your tongue, don't forget to brush your tongue. Most of the sulfur bacteria that create smell are on your tongue, okay? So do all the things to keep your mouth clean and then it'll be better. If you still have a bad smell, you gotta call your health professional. So talking about a health professional, we have another, there you go. Do you know what telehealth is?
And while you're waiting for the poll, there was a question from Jeanette Allen. Does frequent snacking lead to gum disease, exposure of roots, and eat away faster at the root enamel?
So frequent snacking increases the acidity in the mouth. And when you have exposed roots, it doesn't have much enamel on there at all. And so the frequent snacking, the acid attacks the root of the tooth. And as you get older, you'll have more cavities along the root rather than on the enamel part or chewing surface of the teeth. A lot of times you have that exposed part because you have some gum problems. That's why the gums receded. So what happens is those people, when the gums recede, there's irregularity, they tend to have problems cleaning the area. And then with the acid exposure, the plaque is acidic. Yes, it irritates the gums. So it becomes a cycle. I don't know if I answered all of that, but yes, all of these contribute to a problem. Okay, wait, I'm gonna end this poll. Share results. Tried it and didn't like it. That's a half people. Never tried it, but liked the idea, no opinion. I'm wondering about the tried it and tried it and liked it. I thought I said didn't like it. I like it too. And so the thing is dentistry has been one of the slowest ones to get into telehealth, but they're emerging because of all this problem. And so I want to just quickly tell you, call you if you're afraid to go. Some of you were saying maybe not sure about going to the dentist. I want you to think about, find out if your dental office is open. They will probably want to screen you through the phone anyway. But then if they have the thing set up to talk to you, because tell them you have your concerns about coming in or want to talk to them about your tooth. A lot of them are starting to become equipped to do telehealth over the phone, teledentistry over the phone. So what I wanted to quickly tell you is for you to check your own mouth. If you have any of these type of cameras, they usually have a light in it. Use the light to kind of spotlight into your mouth to look in there to see if you can see what your problem might be. Learn how to take a picture with your phone. Here's somebody that's using spoons. You could easily do this. Spread your mouth to show. This is to take like a front picture if you think the problem is right in the front. If you think the problem's more toward the bottom teeth, flip the spoons and use the handles and then tilt your head down, and you might have to have somebody help you actually take the picture, but you could do that. If it's the top, tilt your head up and spread it like that, and you could take a picture. This will help the dentist at least decide, do you have to come in or you don't have to come in? And then of course, this one you pull and pull to the right, and this one you pull to the left. But these are ways that are very easy that many people are using to take pictures of their mouth to send to the dentist. And so that they could just at least help make a decision. If they see something that's really bad, you might have to come in, but sometimes they could exactly see what's wrong and give you just advice and see if you could manage at home first.
Joyce, Linda and Joel, it says, what about brushing 4 to 5 times a day?
Okay, you could brush once and do it real well, or 100 times and not do it well. And then the once is going to be better. So 4 or 5 times a day, if you want to brush after every meal and all that, it's wonderful. But if you're not being really good about the technique and trying to get all the nooks and crannies and brush long enough, 4 times lousy is not as good as 1 time good. So 4 times good, fabulous. Okay, nothing against that. Don't use too hard of a toothbrush or too abrasive toothpaste though. So just try to remember, focus on good hygiene at home, brush the tongue to reduce all those mouth odors, keep your mouth, why brush your teeth and make it so clean? And then your tongue has full of germs and it just like regrows all over the teeth. Don't forget if you have some dental problems, you know, I know it's scary sometimes too or hard, but try to treat them early. They're just going to get worse. If you have dry mouth, please think about how to manage it because you're going to end up with more cavity problems or gum problems. Watch your diet right now. I need to take my own advice on that. I'm not a smoker, but if you're a smoker, please think about right now is a good time to think about how that might not be the best choice. And think about how to keep a clean mask and good breath on that.
Are electric toothbrushes better? This is from Celeste.
Sure. I like a power toothbrush. A power toothbrush is just not so much more effective, but more efficient. I could have a manual toothbrush and do a really nice job. So if you can't get electric toothbrush or power toothbrush, you don't have to have one to do a good job. But think of mowing your lawn. You could have a mower and you mow the lawn and it's going to take you a long time and do good. Or you could get a power mower and zip through it and do a good job too. And one's going to just be a little bit easier. Handicapped people, arthritic people, people who are just struggling with some of their oral hygiene habits, I recommend power toothbrush all the time. But like I said, if you don't have one, just spend the time and the technique and you will do well.
And Celeste was saying that she likes the fact that most electric toothbrushes have the timer for 2 minutes.
Perfect. And a lot of the new ones have, which I personally need, a power sensor, meaning if you're pushing too hard, it lights up. So when I brush my teeth, I tend to press a little too hard. And in the beginning, it was lighting up. And I thought, this must be broken because I know how to brush my teeth. But I actually was using a little bit too much pressure because I'm a high pressure person. And so if you could see my pen, if you hold it like this and brush your teeth, there's a lot of pressure. If you hold it like this, if you're a pressure person and try to brush, there's only so much pressure you could put. So if you know you're the type that scrubs too hard, try to like hold, doesn't matter if it's your toothbrush or your power toothbrush, more like this and brush your teeth because there's reduction of that pressure because you don't want to wear out your teeth. So yes, it's great to have a timer. If you're purchasing one, look for one with, to me, the pressure sensor so you know that you're not over pressure. Okay.
And Linda wants to know if the dental school is taking new patients and providing second opinions.
Yes. They just started they were taking their old patients. They just will start, is it last week or this week, taking new patients? So yes. So in conclusion, the oral health is critical to people's mental health, physical health, and the overall well-being. And I'm talking about not just oral health, body. And good oral health is important during this COVID pandemic. And the most important thing, I even made one here. Keep your smile during the pandemic. It's a hard time, but you know what? If you keep your mental smile, you keep your physical smile, I mean, you just will be healthier all along. So, and thank you. Any other questions? I'll welcome them.
That's great. So if you want to unshare your screen so we can see you up close and personal, that would be great.
Well, I don't want that, but okay.
Craig says, what are the questions for selecting a private dentist office for safety measures during COVID-19?
A lot of guidelines came out, and the bottom line is that most offices have tried to increase their air circulation. So there's air filtrations in many, many offices now. So you want to maybe find out if they have paid attention to that. Most of the time, offices now have upped their what they call PPE. So in the past, there were masks that look more like this. This is we call surgical mask or exam mask. But what happens is there's air leakage in it. So something called the N95, which I know you've heard, what happens is it's a mask that's fitted so tight. When I had one put on at SC, then they put this hood on me and they leaked this smell. And if I could smell it, that means it's leaking. So they kept fitting me till I had a mask that it was sealed so much that vapor couldn't get through and I couldn't smell or taste or anything. So then they knew that N95 was my N95 and not one N95 is good for everybody. So what I'm saying is that if the office is using N95s for procedures, they're sealing anything they might have against you, and you're not going to be exposed to if they're doing all the cleaning. A lot of offices are upping their type of cleaning device, the solutions, and some are fogging. The office I'm at, private office, they fog the air in case there's aerosols in the air. Other people have sprays they're spraying in the room to make sure that it's different. Everybody used to always clean. They changed the cleaning chemicals. And it's to address COVID. And I don't know of any office. I'm with hygienists. I know so many hygienists. Almost every office went that route. A lot of times what they wanted to do is for sure make it safe for their employees. And then in turn, that makes it safe for the patients. So you want to find out if they, their cleaning routine, their air filtration routine, and their PPE or what protection equipment. Most people are screening their patients before they come. They will ask you, you know, if you had fevers and all that stuff. Most offices will take your temperature before they let you in, and also that you wear a mask so that you won't contaminate other patients coming.
So we have two more questions coming in. One is, how do you prevent gum disease? And the other is, please display an example of the electric toothbrush that you prefer. Does it have a round brush head?
Okay.
Where is the pressure warning light on the new electric toothbrushes?
Okay, so let me take that one first real quick. The two most, I don't represent any of them. I'm just giving a practical opinion. The two most popular brushes on the market are Sonicare brand and the Oral-B Braun brand. And one thing that's important, it's not that they're the only ones that would be good for someone, but you always have to remember that you want to change the head. You want to be able to buy that head anywhere at a reasonable price. I one time bought an electric toothbrush because, you know, they were advertising as good and I wanted to try it out. And then I found out the only way to get the heads was to mail order them. And the first order wasn't so bad, but I think they were going out of business. So the next time I wanted to order them, they were so expensive. I could have bought a whole new brush. It's kind of like printers. You get a printer and then you want to change the ink. It's so expensive. You know, after a while, you could have bought another printer. So that, I'd like to stay away from that as far as electric toothbrushes. But so what happens is the Oral-B, the round brush, and the Sonicare, which is not the round brush. The Oral-B works this way. The Sonicare works more like this way. So what happens is that these brushes, they're on the market almost anywhere. So competitively, they have deals. You could go Target, maybe have a deal. You could go to your market and have a deal. You go Costco, they have a deal. So I like to buy a brush that I could get the replacement heads at a reasonable cost. So that's why I favor those. It makes it easy for somebody to buy it. In some studies, it showed the Oral-B Braun, the round one, is more favorable as far as cleaning. I don't really find that true with my patients because it's like the electric lawnmower thing. If you go around and you're doing that, you could do a lousy job if you're not doing it carefully. So it doesn't matter which one you want to pick. However, a lot of older people do like the round one because the Sonicare is a high velocity vibrating one. I actually like it, but some people, my patients have told me, drives them crazy. They like more of the brush one. So you need to kind of like, you know, you could watch it on a video online if you want to just see how it moves. Each model has where they have the flashing light. So the Sonicare has a flashing light on the bottom. The Oral-B had a flashing light near your face where you see it flash, flash, flash. So they all have their own way. And so I don't know which one. I've used both. I have both in my house right now. So I think it's fine. Whatever you want to pick. How do you prevent gum disease? You get teeth cleanings regularly to make sure that the tartar and plaque doesn't get into nooks and crannies that are stained there too long, because what they do is they eventually break down the fibers that hold the teeth in and then the bone that holds it in. Periodontitis means perimeter, dental tooth, itis infection. So what happens, you don't get a hole in the tooth. What you do is you get deterioration of everything holding the tooth in. That's gum disease.
So we've got an active group here.
I know it's time, but it's okay. Go ask, I'm fine.
Craig says, our dental offices doing manual scraping as opposed to the machines for cleaning these days for less aerosol spraying.
Yes, most offices are doing that. However, some, if you have what they've bought in many places is these large external suction type machines. So when someone's getting a cleaning, they put this external suction, that's the best word I could think of, and it turns on, it's sucking the air. And so when they're able to use it, it's going into this, it vacuums it up into that. And so some offices have implemented that, and the studies were showing that 95% of the aerosols it's producing is being sucked in there. And then if they have air machines that are sucking the rest and cleaning devices, that they've had no incidences of transmission from that to date. What else were we going to say? Oh, and so there are other places like USC, if we're going to use that they want the patient tested for COVID before we use it. So
Okay.
some offices might have that.
It's so interesting. Okay, so we're going to go over a few minutes. Celeste says Costco sells the standard electric toothbrush heads. And
That's probably, I'm not sure. The last one I saw was the Oral-B ones. Maybe they have the Sonicare too.
okay,
But it doesn't matter. It's like I said, Costco also likes to, well, like one time I saw they had the sale on the Oral-B's. Another time I saw them have a sale on the Sonicare. Same thing. I saw them have a sale on the actual toothbrush with Oral-B and then Sonicare. They're the two most popular ones. You'll find it, and if you want to wait for a sale, you'll get it.
so I'm going to skip one
Okay.
just because we're going to stay on electric toothbrushes. What do you think about the Sonicare that sprays the water?
That's a new one that I haven't actually used.
Okay.
I like a water pick in general, so then it has the right sound, but I mean the right idea, but I really don't know, and I'm really sorry that I don't know to be able to share that with you. The one thing I want to say though is both of those, remember, in the studies that I saw, they were discouraging it. If you have tested positive for COVID, don't use it for 2 weeks. Because that's both the water pick and the electric toothbrush, because it creates aerosol. If you're living with people, you don't want to contaminate the whole bathroom for them. That's all.
Right. Do you, Jeanette Allen, what do you do in addition to brushing and flossing and drinking water to prevent gum loss?
The brushing and flossing is to prevent the plaque or bacteria from causing inflammation to make the gums too soft and invade the tissue and bone that holds it in, right? And then a lot of times if the gums puff up and it's locked in there, they form tartar underneath the gum. And you ever hear of a deep cleaning? That's to get that out from underneath the gum. So brushing and flossing prevents the plaque and tartar from building up. Once it's built up though, your brushing and flossing doesn't take it out. So that's where then the professional getting the cleaning and having somebody identify if it's in there. So brushing, flossing, and then unfortunately making sure that you're seeing somebody, because I can't even see in my own mouth sometimes toward the back, right? And then drinking water to prevent gum disease. I'm not sure the drinking water, if they're talking about fluoride water or what type of water, but some people, when I saw that, I was like thinking, because some people, they believe in bleach water. You use like a quarter teaspoon in a quarter to half a cup of water and rinse with that to help kill the germs. Dr. Slotz at USC kind of promotes bleach water, a very diluted bleach water to help with that. So it's not widely promoted because the bleach has to be fresh every single time you use it. So.
Is this as opposed to using the diluted hydrogen peroxide?
It's the peroxide, we're concentrating on COVID. Okay.
Okay.
The bleach water is concentrating on, I mean, bleach kills like viruses and the germs that cause cavities and all that. So we're talking a little bit different,
Okay.
animal here. So I was thinking about gum problems in cavities.
Jerry said, I was advised to give up coffee and tea because they leave a residue on your teeth that feeds plaque. Do you agree?
So sometimes coffee and tea, they stain teeth and they mix with the plaque or film on your teeth. There's different levels of plaque. First, there's a clear film that builds on it. It's called a pellicle, and then the plaque builds on it. And so what happens is that the coffee and tea, they definitely have a stain. And what happens, I don't know if the word is feeds plaque, but it integrates with it. And now it's stuck on your teeth. And so one, you have stain, but the other is a lot of times people who just have a lot of it. Do you ever look inside your cup, even if you wash a coffee cup over and over, it starts to like, oh, yeah, I thought I washed it. It's starting to get kind of dark and stuff. It permeates and it gets in there. So, we just try to like, I drink coffee every day. So, I try to just always rinse out with water after. And so it helps kind of, I brush my teeth and I rinse with the water. They say though, I'll tell you, this is kind of crazy. If you eat remember I told you your acid goes up, okay? Because just from the bacteria trying to break down your foods and everything, but acidity goes up. A lot of times they recommend you wait. If you eat, don't rush and brush your teeth right away, because with the acid left, you're going to wear down some of the enamel. They usually recommend you wait at least 30 minutes after you eat before you're going to brush.
Wow. Is it harmful to use Crest teeth whitener strips?
Unless you're some kind of maniac that does it like so much, you know, but they are one of the lower whiteners. So what happens is that if you went to the dentist, they're going to give you a stronger one and use it for a shorter amount of time to get white teeth. If you use the Crest strips, you're going to get the same results, but you have to be disciplined to use it for a longer period of time, weeks. So is it harmful to use them? No, it's not shown. The only thing I could say about it is if you have recession, where remember I told you where your gums recede and you have areas that don't have much enamel on it, when you use it, people complain about sensitivity. It kind of like, you know, you drink cold water after and it's like, ah. So, you know, so it's not damaging it, but like make sure if you're using whitening strips and you tend towards sensitive teeth, to please use sensitive toothpaste at the same time.
That's great. Well, thank you. It says, thank you so much for answering our questions. And Jeanette Allen says, I will make an appointment with my dentist for the 6-month checkup. You were very thorough. Yes.
Yes, it's important. When you wear your mask, every time you wear a mask or see someone wearing a mask, think, aha, that mouth is so important, especially during COVID.
Yeah, that's very true. And I did get my 6-month dental checkup, you know, and USC did a wonderful job, and they were very, very careful, and they really space people out, and they clean everything up, and they don't do the aerosol thing, you know, they have the suction, you can't spit, all that stuff. So, but again, thank you so much. This was really, we're very grateful that you came. This is the first time we've done one that's just concentrated on the mouth. And I congratulate you because we had 28 people and they're still here and there's 309. So again, thank you so much, Dr. Sumi. We really appreciate it. Yay.
My pleasure. It was fun talking to everybody. Take care. Take care. Be safe during this time.
And thanks, Leanne, for helping us out. And thank you, Katie. Take care. Bye-bye.
Thank you. See you.
Bye-bye.
Bye.